Hi, it's back to basics for the February 2021 mat stroke back care routine. So we're going to start off with a seated breath to illustrate the lateral breath where we breathe into the back and the sides of the rib cage. Now, if you are managing any disc issues, you may prefer to start with a lying breath where you lie down on your back and just pop your hands onto the front of your ribs instead, okay? So I'm sitting on a block, which is going to help me get my spine into a nice straight position. And with a straight spine, back of the head, in between the shoulder blades, and your sacrum at the back of the pelvis should all be as close to the vertical as you can possibly get them. Legs are parallel, knees are softly bent, and we place the hands to the outside of the knees, extending the spine towards the ceiling. We're taking a soft breath in, and as we do so, we draw gently into pelvic floor and transverse. Breathing out, we flex the spine forward, starting at the top of the spine, working in sequence towards the bottom, and moving through our pain-free range of movement only. When you get to the end of your spine flexion, we're going to stay there, breathing in and breathing out 3 times. And in this position, you'll be able to feel the way that the air enters the lungs and makes the ribs inflate to the back and the sides of the rib cage. Illustrating that breathing laterally, breathing sideways into the ribs. We'll take one more breath in, and then exhaling, we'll rebuild the spine, coming back to the neutral in seated, vertebra stacking on top of vertebra until we've got that lovely long straight line from the crown of the head down to the tip of the tailbone. Let's revisit that again. So breath in, engage the deep pelvic floor, so you draw up gently internally, the transverse abdominals, you draw navel towards spine. As you exhale from the top of the spine, working in sequence towards the bottom of the spine, we flex forwards, hands slide down towards the ankles where we hold it, breathing in. Inflating the ribs to the back and the sides and breathing out. Breathing in and breathing out. One more cycle of lateral breath, nice deep breath in and out. We'll take one more breath in, using the breath out to rebuild the spine, stacking vertebra upon vertebra, to bring it up to seated neutral. Wonderful. Now we'll stay seated, or if you're lying, stay lying, and we'll work pelvic floor. So we're going to isolate the pelvic floor and work them maximally. You're going to make sure that you don't clench your buttocks. So we draw up into pelvic floor with a maximal contraction, and we hold it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then let it go. Let's go again. So I want you to imagine you're pulling away from the gusset of your pants. We draw up internally and we hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release it. We'll go one more time. Now don't be alarmed if initially by the time you get to 10 your contraction of the pelvic floor isn't quite as strong as it was when you started at 1. That's quite normal. Your strength will build as you practice them, and it'll be really, really good to practice these every day. Let's draw up again internally, sitting nice and tall, maximal contraction, pulling away from our pants. We hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, release. Now remember that our muscular strength can be affected by hormones. So as we age and our estrogen decreases, then it is quite common to find that your pelvic floor is not as strong as it was, and that is why it is so important to keep working it and to do your pelvic floor exercises every day. It will decrease how much strength you lose into your pelvic floor. So we're going to lie down on our back now, for those of us who are working as seated, and we're going to practice moving our pelvis, and the exercise that we're going to use is a pelvic tilt. Now when you lie down on your back, if you feel that your chin sticks up into the air like this, it is important to pop something underneath your head. So you can use a folded up towel at home. I've got a little pad here that I'm going to pop underneath my head, and that affects the position of your neck. So your neck should be in a neutral position, a comfortable position where it's not strained. If your chin sticks up into the air, then you're in hyperextension with your neck, and that's not a great position to be in. So use a pad of the appropriate size to pop your head into a much more comfortable position for your neck. Arms go down by the sides and we press the shoulders back and down. Legs are parallel. Now the bones at the front of the pelvis give us an approximate kind of idea of where our pelvis is in space. So when our pubic bone and hip bones are flat and level, horizontally, because we're horizontal, that is neutral pelvis, okay? And if pubic bone sticks up in the air, we're in a posterior pelvic tilt, we're in a flat back position, the lumbar spine's flattened to the floor. So we'll be going from neutral into flat back, neutral into flat back, and the movement's called pelvic tilt. So if you start in neutral, bones at the front of the pelvis flat and level to each other, take a soft breath in, gently engage pelvic floor and transverse. So you're drawing up away from your pants, but also away from your waistband. And then as you exhale, tip the pelvis backwards, flatten the lumbar spine. Inhale, rock back to neutral. Exhale, tip back and flatten. Inhale, rock back to neutral. Now, if you're managing any pain conditions, if you find a particular exercise increases the pain that you are managing, then it's not a good idea to work through that exercise just at the moment. So always listen to your body. If you're managing pain and nothing happens with the level of pain that you're managing as you do an exercise, it's fine to keep working through it. And sometimes you'll find that you start off with pain, and as you work through an exercise, your pain decreases. So it's only when a particular exercise makes the pain that you're managing worse that you need to stop what you're doing. We'll do 2 more repetitions of pelvic tilt in and out of the flat back position. And then on this last one, we're coming to neutral, and we're going to stay in neutral. We're keeping our pelvis still, we're going to move our leg. The movement that we're doing with our leg is called a knee drop. So the deep pelvic floor, the transverse, again we softly engage, then we move on the breath out to send the knee out to the side and back to the centre. And as we work the knee drop, we are making sure that our pelvis does not roll over to the side like this with that leg as it goes out into the knee drop. So you can notice where the back of your pelvis touches the mat, and if you keep good connection in the same point of contact between your pelvis and the mat, then you know that your pelvis is nice and still. You can also, as I'm doing, keep your hands on the bones at the front of the pelvis. They will give you a good guide as to how still your pelvis is staying. We'll make this our last one. We'll move to the opposite leg, and I want you to re-engage your core before you do so. So draw up, draw in. Opposite leg, knee drop out, knee drop in. Using the breath out to send the knee away, breath in back to centre. Knee drop is a really good exercise just to keep the hip joint mobile, as well as being a basic pelvic stability exercise. We'll do a couple more repetitions with the opposite leg, and then when we finish this last one, we'll move into heel slide next. So again, keeping the pelvis still, softly engage your core. You heel slide, you're lengthening the leg down the mat before sliding it back up. Change to the opposite leg. And with heel slide, the temptation will be to let your pelvis roll forwards, let your pelvis roll back, let your pelvis roll forwards, and let your pelvis roll back. So you are trying to keep your pelvis still again as you're doing heel slides. Using the breath out to lengthen the leg, breath in to bring it back in. work that once more time on each leg. And then more challenging for the core, we will work knee folds next. Moving our leg at the hip joint to come into tabletop and out of tabletop. Knee should be vertically direct above the hip at the top of the table. Try to avoid bringing your knee over your tummy because it's likely that you'll posterior tilt and flatten your back when you do your knee folds in and out of tabletop if you do bring your knee directly up over your tummy. So if you're able to, when you're lying on your back, think long collarbones, shoulders pressed back and down, trying to keep a nice strong upper body position. And at the moment we're working our single knee folds. Now the double knee fold works a little bit harder, so it brings one leg to tabletop, it holds it there, and then we float the opposite leg up as well. First leg goes down, second leg goes down, we change the lead leg. We bring non-dominant leg up, followed by dominant leg, non-dominant leg down, followed by dominant leg. Now this is really hard, so if you find you're lifting up and when you try to lift your second leg up, your back moves and it generally moves into extension, meaning that your pelvis rocks that way and your tummy stick up into the air and you get a massive curve underneath your lower back, then that illustrates that you're not quite strong enough for that level yet. The other thing that can sometimes happen is abdominal doming, where you lift your leg and then you push your tummy muscles up in an effort to get that second leg up. Again, that is wrong as well. So with your transverse, you always want to be drawing away, navel towards the spine, and keep drawing away, making sure that you don't get any abdominal doming, okay? So abdominal doming is an illustration that the level that you're working at is too difficult. And if you continue to work at that level that's too difficult, it won't do you any good at all. You'll just get into a really, really bad habit of sticking your tummy muscles out when you're trying to do something difficult, which is not a good thing to do. We'll make this our last one and then we'll be moving onto our side to do side lying spine rotations. I'm going to face you for the first set. Offsetting our legs. So we're bringing the knees and the hips into a right angle and bringing the spine down to neutral in side lying. I've got a slightly bigger pad to stick underneath my head so that my neck is supported in neutral when I'm lying on my side. Feet, knees and pelvis are all going to stay still for this exercise, and we're twisting the upper back, so it's thoracic rotation. Taking a breath in, we engage our core and reach to the ceiling looking at the hand. Breath out, we roll backwards with our head and our shoulders. Now you'll get to a certain point where you're not going to roll backwards anymore. At that point I would like you to stay there, take a breath in, and then breath out, return. We'll go again, breathing in to engage and reach, looking at the hand, breathe out, roll your head and your shoulder blades backwards, hold the end point, breathe in to stay, and breath out to return. Breathing in, engaging our core, we'll reach, breathe out, roll, almost as if you're trying to roll yourself over onto your back. Pause at the end point of your rotation for a breath in, and breath out, release. Let's go one more time, breath in, engage and reach. Now done incorrectly, the rotation becomes a stretch of your arm backwards. So it's important that you don't stretch that back arm backwards like this. It should always be on that initial line as you rotate. So your movement is in your spine and it's not a stretch of your arm, reaching your arm back behind you with your side lying rotations. Okay, we're going to come up into kneeling and we're going to work on the shoulder girdle. So movements of the shoulder girdle, it can elevate and it can depress. So the shoulder girdle will sit at a particular point for all of us, okay? And from that point it can go higher, it can return to that point, it can go lower. It doesn't tend to go very much lower than where it's set, so that trying to draw your shoulder blades down the back is quite a difficult move to do. So if we breathe in, elevate the shoulder girdle. Breathe out, let it sit back down where it normally does. And then try and reach a little bit lower and let it sit back where it normally does. So we'll breathe in to lift. Breathe out to lower. Breathe in, take it lower again. Breathe out to neutral. Breathe in, lift. Breathe out lower, let it sit where it normally does, and then try to go a little bit further down and then back to where it normally sits. So we've got elevation, shoulder girdle comes back to where it normally sits, followed by depression, and then where it normally sits. We'll go one more time. We'll raise the shoulders, release them, slide them down the back and release them. Now from there, we are going to try to keep the shoulders down, float our arms up and float our arms down. So I want you to feel like you're putting your shoulder blades in the back pockets of your trousers for this movement. And as your arms float up, absolutely nothing happens with the position of your shoulder blades. So the arms are floating and releasing, but our shoulders, when we lift the arms up, don't come up with them, okay? So we don't want this to happen. We're keeping the gap between the ear and the top of the shoulder while our arms float up. We'll hold the next one in the float position. I'm going to turn my back just so you can see my shoulder blades. And then we're going to squeeze shoulder blades together, release them to neutral, try and stretch them apart, release them to neutral, squeeze them together, release them to neutral, stretch them apart, release them to neutral. From the side, this looks like shoulder blades squeeze together, neutral, stretch apart, and neutral. Squeeze together, neutral, stretch apart, and neutral. And from the front, it looks like you're pulling your arms away and then stretching your hands forwards. So it's a pulling away and a stretching forwards. This is retraction and this is protraction. So all movements that our shoulder girdle can do, our shoulder girdles, our shoulder blades and our collarbone, and those two bones together make up the socket for the arm bone to sit in the shoulder joint. So whenever we move our shoulder girdle, our arm position will change as well. We'll make this the last one, and then we'll release those arms down. Lovely. We'll go to side lying opposite way. Now I'll turn my back. We'll come into our side lying neutral spine position. Long line from crown of the head to the tip of the tailbone, remembering to bring the feet and knees forwards. So our feet, our knees and our pelvis are a fixed point. We breathe in to engage the core, reach the arm and look at the hand. Breath out, rotate. Hold the end point of the rotation to breathe in and breath out to close. Again, breath in, engage the core, reach the arm and breath out, rotate. Breath in, hold it and breath out, close. Remembering that this is not a stretch of the arm backwards, so when we rotate, it's almost like we're trying to roll onto our back. We're not trying to touch that hand down to the floor. So the movement comes from our spine as we roll it back. And it is quite common with this one that your movement gets bigger with each repetition. Breath in, hold, and breath out, release. Last time. Breath in, engage and reach. Breath out, rotate. Breath in, hold, and breath out, release. Now we're going to flex and extend the spine with our cat stretch next. And we'll come to 4-point kneeling, placing our hands under shoulders and knees underneath hips. So breathing in, if we engage our core, and then breathe out, we flex the spine, tuck the tail between the legs, the chin towards the chest, and that rounds into our back. And breathe in, we extend the spine, sticking the chin and the bottom up into the air. So cat stretch is a range of movement mobilisation through flexion and extension. It's generally well tolerated in most pain conditions. Can be a little bit tricky if you've got one of your back muscles that's gone into spasm. Then you might find that cat stretch is a little bit challenging to do. But it is a good thing because it will help to get you out of your spasm. We'll make this the last time through. And then we're going to come to neutral in 4-point kneeling. Now this is a tough one to get your head around because in class your Pilates teacher would be your eyes, okay, and when you're working at home or you're working to a video or a recording, it's difficult to know where your spine is in space unless you're working with a mirror. So in neutral there should be a gentle curve in your lower back, a gentle curve in your neck, not letting your head drop down like this. This is one of the most common faults to happen. So you're doing something called a chin retraction to keep your head in the neutral position. And then without changing the position of your back, we're going to engage our pelvic floor and our transverse abdominals and hold them. And this is called abdominal hollowing at 4-point kneeling with our spine in neutral. And we're drawing up and drawing in with those core muscles as we keep our pelvis and spine nice and still. Let's let them release. Now, one of the most common incorrect things to happen when you do abdominal hollowing in 4-point kneeling is for this to happen. And this is spine flexion, and this means that it's not your transverse abdominals, but your rectus abdominals that are working, okay? So you lose the lumbar curve, you round into your lumbar spine. So with transverse abdominals, it's all here, okay? So this should lift, yeah? But this should keep the curve. So abdominal wall lifts, yeah? And that is what you're looking for, this flattening of the abdominal wall, but without the rounding into the lumbar spine that you would get if the rectus abdominals were active. So we're holding like a table, pulling our core muscles in and keeping everything nice and still. We'll hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. We'll do again, pelvic floor transverse, draw up and in, holding, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release it. Okay, from there, we will come up into a kneeling position. We're going to do scissor arms, extending one arm, and then the opposite arm. So we're moving from the shoulder joint, keeping the elbows nice and straight with our scissor arms. Now we'll progress this into arm scissor to lateral flexion. And that means that you're going to add movement of your spine. So we'll keep the arm up in the air. This hand is going to slide down the leg. That means your spine bends to the side. And what shouldn't happen is any other movement apart from your spine bending to the side. But what commonly happens is this, and your elbow bends as you go over. The reason your elbow bends as you go over is because it will take some of the stretch out of it, and your elbow will bend if the muscles that attach your arm onto your torso are very, very tight. So watch out for that happening with your movement. So you have movement of the arm at the shoulder and then movement of your spine as it flexes laterally. Movement of your arm at the shoulder, movement of the spine as it flexes laterally. Noticing how far down you can go on each side. and whether it feels the same or different to each side while you're doing your scissor arms into lateral flexion. We'll make this our last time to each side. And then we'll be working some chin retractions. Okay, I'm going to turn side on so you can see what I'm doing. So our chin retraction pulls our head back and releases it. Pulls our head back and releases it. If you imagine that your chin is like a book on a bookshelf and you're pulling the book off the bookshelf, putting it back on, pulling the book off the bookshelf and putting it back on. And it's the neck that will stack up and realign as you pull your chin back into retraction. From the front, we call it the ugliness exercise because we all get a few double chins when we do this one. This is a great one to do if you spend a lot of time working at a desk, because invariably you end up with your head in a forwards position, and this will just bring it all back and realign the joints and muscles in your cervical vertebra. We'll make this our last one and we'll release. So we're going to lie on our back again and we'll do a rotational exercise with the knee roll exercise. And for this one, we're going to be working with our legs adducted together. Adducted means glued together. So feet, knees, inner thighs, everything glued together. Imagine that somebody's wrapped cling film right round your body from your waist all the way down to your feet. Stretch your arms out a wee bit. I focus up towards the ceiling. And then I want you to think about 3-point balance, with the back of your skull and your 2 shoulder blades being your points that you're balancing on. And you're keeping your balance while you rotate your pelvis, your knees and your feet to the side and back to the centre. So shoulder blades are staying glued down, back of the head stays glued down, and you're looking up towards the ceiling. I would like you only to go over as far as you can keep 3-point balance, and also keep adducted. So if your knees are separating like this or sliding off each other like this, you've gone too far. If your shoulder blade is coming off, you've gone too far for this variation on the knee roll exercise. We're going to work that one more time in each direction. So it teaches us to keep stable from our pelvis down to our feet as we rotate. When we come back to centre, let's go to hip joint distance with the feet and the knees and bring the arms back down by the sides. Now we're going to extend the line of the pelvic tilt to shoulder bridge next. I'm going to remove my head pad, and you might want to do the same or just reduce the height of it. So we take a breath in to engage our core, and then on our breath out, we tip the pelvis backwards into that posterior tilt, flatten the lumbar spine, and then we roll up onto our shoulder blades. When we get there, we're going to breathe in. Now the top point should be when it feels like you've got a straight line from your knee through your pelvis to your shoulder, and then we'll breathe out, we'll roll it back down, and we're trying to print every single vertebra in our spine down onto the mat before bringing the pelvis back to the neutral position so the lumbar curve reappears. We breathe in, engage, and breathe out, roll up, vertebra by vertebra, picking it up off the mat. Breathe in when you get to your shoulder blades, and breathe out, vertebra by vertebra, rolling back down, back to neutral. Engage, deep pelvic floor transverse, exhale, rolling up. Inhaling at the top, exhaling, rolling down. Now do notice your foot and your knee position with bridge. So you should stay in 3-point balance through your feet, and the 3 points of balance through your feet that you're looking for are the centre of your heel, and then through the ball of your foot at the base of your big toe and the base of your little toe. One of the things to watch for with bridge is when you get to the top of the bridge, do you shuffle your feet closer towards your bottom? And one of the reasons that people shuffle their feet closer to the bottom is because when they've bridged, they've pushed themselves up the mat. So they've slid up the mat. And each time they're not rolling, they're kind of pushing into their feet, and you're getting further and further up the mat. So your heels are getting further and further away from your body, your bottom, the further up the mat that you get. Now that shows that you're not actually rolling and articulating through the spine. If you're sliding up the mat, you're just pushing away with your feet, okay? So really try to get that articulation up, articulation down, so that your head stays in the same place on the mat and you don't start to roll yourself or push yourself up the mat as you're bridging. We'll make this our last time. Breath in, engage. Breath out, roll up. Breath in at the top and breath out, rolling back down. Now we are going to move into head nod or skull rock or chin tuck, whatever you want to call it. And when we're lying on our back, it's a very, very gentle movement of our head. It rubs the back of the head on the mat, and it brings our forehead just a little bit higher than our nose, and our nose a little bit higher than our chin. It also extends into the cervical spine, and we need the chin tuck movement before we lift the head and shoulders off the mat, so that we don't lead the lift with the chin. So we'll just do a couple more rocks in and out of chin tuck. And then we're going to use that chin tuck as part of our prep. Now, ab prep is an exercise where we are hoping to strengthen the transverse abdominals. So the pelvis and the lumbar spine should stay in neutral, and it's a very, very small lift of our head and shoulders. So we take a preparation breath in to engage our core. We rock the head into chin tuck. As we exhale, head, shoulder blades and arms come just up off the mat. Pelvis and lumbar spine should still be neutral at this point. Breath in to hold, and breath out, release down. Again, breath in, engage the core, rock the head. Exhale, raise the head, the shoulder blades, the arms, they're just off. So you've still got your gap here. You're beautifully flat here with the bones at the front of the pelvis aligned. Breath in, hold. Breath out, release down. Engage and rock. Exhale. Inhale, hold. Exhale, lower. Engage and rock. Exhale. Inhale. Exhale, lower. So you need to be careful with ab prep that you don't overflex your neck. And by that I mean bringing your head off the floor like this. Okay. So it's a gentle lift. We'll make this our last one. Wonderful. Okay, now we're going to work on shoulder girdle next with the breaststroke preps. And for this, we want to be lying on our tummy with something underneath our forehead to keep our neck in neutral. Legs should be parallel, and that means your heels should be facing directly to the ceiling. So make sure your heels don't either roll out or roll in. Okay, so your legs shouldn't be in a comfortable position. They should be in parallel, and it may be uncomfortable for you to keep them there. So we place the arms in a W position. Now breaststroke prep 1, we're going to work depression of the shoulder girdle. So if you lie on your tummy with your arms in a W position, just practice a few repetitions of sliding your shoulder blades down your back, keeping your hands and your forearms still. So slide the shoulder blades, let them release. Slide the shoulder blades and let them release. Your forearms should not move. So your hands and your forearms stay in the same place. If your arms are sliding down and sliding up, then you're not moving your shoulder blade, you're moving your arms. Now, when you move your shoulder blade, your shoulder joint will change position. So the top bone in your arms, your humerus, will move, okay? But the lower bones in your arms should stay exactly where they are. We're going to put a little bit of spine extension into that, okay? So we engage our core, slide the shoulder blades down the back, and a gentle peel of your face and chest away from the mat. So you're looking towards the top of your mat. Exhale, release the spine. Inhale, release the shoulder blades, lifting the shoulders towards the ears. Exhale, slide the shoulder blades down the back. Inhale, peel the face and chest off. Exhale, release chest and face down. Inhale, release shoulder girdle. Core is engaged as we slide the shoulder blades down. We're peeling the face and chest off, releasing chest and face down, releasing shoulder girdle. With stage 1 breaststroke prep, your arms are very light on the mat. So you're not pushing with your arms at all. You're allowing the muscles in your back, down your spine, to peel your chest off the mat. This should feel like you're trying to lift your breastbone, your sternum. Okay, so it's a sternal lift that you're performing as you peel off. Slide the shoulder blades, peel the face and chest. Release the chest and face, release the shoulder blades. One more time through. Slide the shoulder blades, peel the face and chest. Release the chest and face, release the shoulders. Now stage 2 is going to work scapular retraction, and for that we're going to put our arms down by our sides. So if you rest your arms on the mat so you are palms facing upwards towards the ceiling. For your scapular retraction, if you squeeze your shoulder blades together, again your shoulder joint is going to move, and that means that the upper arm bone will move when you squeeze your shoulder blades towards each other. Just practice a few of those retractions lying on your tummy, squeezing and releasing, leaving your hands resting on the floor, squeezing and releasing. So it's shoulder girdle, retract, release, retract and release, retract and release. Now once you've got that retraction perfect, we're going to add some external rotation of the shoulder joint. What that means is that we will squeeze our shoulder blades towards each other, and then you're going to turn the palms of your hands and your elbows in towards your legs. So we rotate them in, rotate them out, release the shoulders. So we've got scapular retraction followed by external rotation of the shoulder joint. We'll release the rotation, release the scapula. Scapular retraction, external rotation of the shoulder joint where you're tucking those elbows and palms in. Release the shoulder joint, release the scapula. We are going to add a little bit of lumbar extension. So when you have externally rotated your shoulder, slide your hands down to the outsides of your thighs, increasing the curve here in your lower back. Release it down, release the shoulder girdle, shoulder joint. So we squeeze the shoulder blades towards each other, rotate into the shoulder joint by squeezing the palms and the elbows in tight to the body, and then we extend into the lumbar spine, floating off, releasing down and releasing the shoulder girdle. So shoulder blades together, shoulder joint rotates, lumbar spine softly extends, and releasing the lumbar spine, release the shoulder girdle, release the shoulder joint. Shoulder girdle, shoulder joint, lumbar spine. Legs should stay on the floor. Release the lumbar spine, release the shoulder girdle and shoulder joint. And we're keeping those core muscles just softly engaged all the time while we work our breaststroke prep 2. And we'll go for one more repetition. Shoulder blade, shoulder joint, lower back. Release the lower back, release shoulder joint, shoulder girdle. Lovely. Okay, so just pop your hands underneath your forehead. We are going to work abdominal hollowing in prone lying. Now your whole body should stay in contact with the floor, but the amount of pressure between the abdominal wall and the mat should decrease. So you're just drawing your pelvic floor up, drawing away from the waistband of your trousers, and that is going to decrease the pressure between the abdominal wall and the mat. We're holding it. Keep that focus on pulling up and pulling in with those transverse abs, pelvic floor muscles. 5 more seconds. 4, 3, 2, and 1. And then let the muscles relax. We'll go again. Pelvic floor, transverse abdominals. We hold it. Drawing up into those muscles for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let the muscles release and relax. Let's go again. Pelvic floor, transverse abdominals. Keep pulling those 2 groups of muscles up. Holding. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and gently release them. Now we'll stretch that back into a position called shelf. So we're going to sit back, bottom onto the heels, and flex forwards as close as you can towards the thighs, trying to get your head down onto the floor. So you may find that you need something to support your head with, which is absolutely perfect. If you do, just use something. Arms should be long and straight, reaching the fingertips as far forward as you're able to, unless you're managing a shoulder issue, in which case you may prefer to tuck your hands back by your heels. One more cycle of breath in and out. And then we're coming up into 4-point kneeling with our pelvis and spine in neutral. Now in this position, let's do abdominal hollowing in 4-point kneeling. And then either with the feet flat or the toes tucked, whichever is your personal preference, we float the knees just up off the mat. So it's a very, very low lift. Hold and lower. So we engage, knee float, hold and lower. Engage, knee float, hold and lower. Engage, knee float, hold and lower. One more time, engage, knee float, hold and lower. Releasing from there, let's stretch the chest. You're going to link your fingers behind you, squeeze the shoulders back, extend the arms. Now we're going to strengthen arms with a push movement next, and we'll do a box push-up. So we're going to be in that 4-point kneeling position, again with our spine in neutral. Hands directly under shoulders, knees directly underneath hips. Okay, now to load the arms, you sway forwards, sway back. Tiny sway forwards, sway back, sway forwards, sway back. If this is enough for you at the moment, that's fine. For the push-up, we sway forwards, we hold the sway, bend the elbows only as far as you can keep your spine neutral, extend the elbows, sway back, sway forwards, bend, extend, sway back. Now as you get stronger, you'll find that your range of movement can increase with your bend extend, and it is a pretty vigorous exercise. I find this hard going to keep my spine in neutral and to do a box push-up, and I'm fairly strong, so we sway, we bend. So it's important that you work through the range of movement that suits you, that you can keep your spine neutral through. So we don't want any movement of the spine. You're doing isolated movement at your elbows, a little bit of your wrists and your shoulders, secondary movement with your push-up. We make this our last one. We'll stretch the triceps. So you come up to kneeling, one hand in between your shoulder blades, You can either press the fleshy part of the arm, or if you've got quite mobile shoulders, you may find that you prefer the exercise where you link and grasp your fingers. We'll release and change arms, taking that stretch into the opposite arm. And again, same option here. If you want to reach and grasp your fingers, that is perfectly acceptable. We're stretching the hip flexors next. We'll do this from a kneeling position. So you're going to step 1 foot forward, slide your foot further away than your knee, and lunge into it. So your knee's directly above your ankle. The stretch is on the back leg here. Keep the spine tall. Press the palms together. You have the option, if you wish to, keep your palms pressed firmly together, particularly the heels of your hands underneath your little finger, and extend towards the ceiling. Releasing, changing legs. So remember to slide your foot further forwards than your knee and then lean into the stretch. Again, an option for palms together, with or without that reach to the ceiling. Releasing the arm, releasing the hips. We're going back to our supine line position where we're working on our back. We're going to practice the Pilates 100. It's called 100 because we do 100 breaths. The aim of it is to keep our pelvis and our spine in neutral while we do our 100 breaths, and we need to work at an appropriate load level. That is good for us. Okay, so with our pelvis and spine neutral, let's bring one leg to tabletop. You have got the option, if you're strong enough to get your second leg to tabletop, to bring that leg up as well, but I'm going to take the easier option and just work with a single knee fold. We're going to extend the leg to load into the core, keep the head down, float the arms up, and we're doing 50 beats with one leg extended. We breathe in 2, 3, 4, 5, and out 2, 3, 4, 10. As we're breathing, our focus is on keeping pulling up and in with our transverse abs and our pelvic floor muscles. Out 2, 3, 4, 30 in, 2, 3, 4, 5, out 2, 3, 4, 40 in, 2, 3, 4, 5, single legs change, breath in 2, 3, 4, 5, out 2, 3, 4, 60 in, 2, 3, 4, 5, out 2, 3, 4, 70 in, 2, 3, 4, 5. Think core, 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 keep it all in. Out 2, 3, 4, 90 in, 2, 3, 4, 5, and out 2, 3, 4, 100. Release, lengthen to full body stretch. Circle the arms, bring one knee towards the chest, tucking the pelvis back into posterior tilt and flattening the lumbar spine to the mat. If your other leg stays long and straight, you can flex the foot and clench the buttock on the long straight leg if you wish to get a little bit more stretch across the hip. Take the hands to the ankle and then extend the leg. So you're now feeling stretch here into the back of the thigh, keeping the knee bent. Try to encourage your muscles to relax into position. Notice if anything odd has happened to your face. So if your chin is stuck up into the air like this, correct it with a little bit of a chin rock. We'll release that leg and change to the opposite one. So we're lengthening, flexing the foot, drawing that other thigh towards the chest, and we can clench the buttock on this thigh. Good posterior pelvic tilt. Hands go to the ankle. We extend the leg at the knee, and the stretch is in the back of the thigh. And the muscle called the hamstrings. And we will release it from there. Moving to figure of 4 stretch. Bring your pelvis and your spine back to neutral. One foot on the floor and the other foot on the opposite knee. And then try to keep neutral, lift the leg off. This knee needs to be rotated out. So try not to go to flat back. You may find that you do want to support your leg by linking your hands around the back of your thigh. And it's perfectly acceptable, again, not to support your leg and just to let your leg work a little bit hard to hold the stretch. We'll release down, change it over, opposite side. So we're turning out, keep pushing that knee out as you lift the leg up, and that should give you a rather lovely stretch right into the outside of the hip joint. You might feel it running into your buttock, you may feel it coming around into the outside of the thigh. Hold it, and then we're going to release it down. Lovely. Rolling onto your side, and push it up. And then we're going to use a functional movement called a lunge to bring us to standing. So I want you to put your best foot forwards from your kneeling position, touch your toe on your back leg, lengthen, engage, and just push up to standing. And then once you've got there, nice deep breath in, stretch to the ceiling and release. Lovely. I hope you've enjoyed that. It was a revisit of basics, and sometimes it is very important just to go back to basics to check our own technique. Includes me as well. Great work.